So Healthy Communities in Hope has been established for the past 10 years. About every 2 to 3 years we look at priorities. We come together for Mobilization Day, and it was time for us to do that. And this funding came along very nicely and fit into that to help us facilitate that day. So the Healthy Communities Committee, in conjunction with local government, applied, looked at what we wanted to be looking at as priorities. We had a full-day workshop that was facilitated, and we had 40 people come out, various ages, right from high school all the way up to the seniors came out to participate. We did roundtable discussions, identified 4 priorities by the end of the day. And the beauty of that is that you've got people who are passionate about those priorities. They're going to take on those priorities and be part of the subcommittee. So as local government, we don't necessarily have to always be the leaders that are going to take on these initiatives in our community. We support the initiatives. They can come to council and let us know what's happening with those initiatives. And if they need any further support, we can do that. So that is really the Mobilization Day. So Healthy Communities is reconvening here in September, and we will be looking at the various priorities. 5210 was one of the priorities that was identified. So we are working with the school district. We're working with Fraser Health on that, and the local government will also work on that initiative, and MCFD. So we'll work on that together as one of the priorities. Well, because we're going to hit the masses in the school district. You're going to hit those kids out there. You're going to hit the families. We're going to work with the Rec Commission to try to get them on board to promote that in the Rec Center. You're promoting it in the schools. You're promoting it at Ministry for Children and Families. They see lots of families who, they don't recognize the need and the importance of, 5 fruits and vegetables a day, and getting out and being active in the community with your kids, right, playing. So it's a really positive movement for the community, and that's just one of the initiatives that came out of that day. The other is a volunteer program, looking at how we can build capacity with our volunteers and leverage them in our community, because we rely on our volunteers in our communities, and if we don't have them, a lot of the things that we do are not going to be sustainable, and you won't have the community coming out and participating as you want them to be. Well, one of the very first initiatives that Healthy Communities worked on was a transit system. We didn't have transit in Hope, and so we were finding that people were feeling isolated in their communities. Not that we want them to go outside of Hope, but even to just get around in the community. So one of the initiatives 10 years ago was transit, and it's Care Transit, and it's just a local, small little nonprofit that was created to look at transit needs in the community. And from that, it's expanded its ridership. It does take people down to medical appointments outside the valley if they're unable to. Charges a small nominal fee. And from that, we've been able to get BC Transit to come out, and we're looking at a pilot phase for transit, public transit, to take people from Hope to Chilliwack to meet the needs, medical needs, whatever needs that they need in Chilliwack. So it's not to pull people out of Hope, but there definitely sometimes is a need to have to go to a bigger urban center for, whether it's doctor's appointment, specialist appointment, whatever. So it's not navel gazing. It's about looking at the real issues that are impacting your community and working with your community people to say, how can we address this together? It's very satisfying, both in my nonprofit world and in my local leadership role. It's very, very rewarding to see the successes.